Most teens rarely seek medical care. For many, the pre-participation or sports physical may be the only health care visit they have during the year. Therefore, it is important that the examination is thorough and that patient education address the issues pertinent to teens, even those not directly related to sports. The pre-participation physical is used to evaluate the general health of the teen and to identify any pre-existing conditions that might increase the child's risk of injury. Particular attention is paid to assessing musculoskeletal integrity and cardiovascular and respiratory status. After determining the type of sport and the level of competition, it is imperative to obtain a complete medical history. This should include a history of previous trauma, surgery, hospitalizations, cardiovascular conditions, asthma, seizures, and bleeding disorders. A patient with a pre-existing condition or history of trauma may need a referral or consultation before being allowed to play. Also, obtain a history of risky behaviors such as alcohol or drug use, smoking, sexual activity, and the use of steroids. This is a good opportunity to talk about the possible consequences of such actions and for referral to rehabilitation, family planning programs, etc. Once the history is complete, assess the blood pressure. If the reading is high, have the patient return for a recheck. Many teens are quite apprehensive about a physical exam of any kind. Now use a Snellen chart to determine visual acuity. Poor vision can result in injury during sports as well as poor academic performance. Next, have the patient disrobe except for her bra and panties and sit on the table. Examine the skin thoroughly. Pay particular attention to any lesions that might be contagious. For example, tinea corporis is particularly common among wrestlers, who must be excluded until treatment is initiated and they are cleared to participate again. Check between the toes for flaking and cracking that may indicate tinea pedis or athlete's foot. Examine the eyes. Are the pupils equal to light and accommodation? Further examination of the eyes is usually not performed unless indicated. Talk with the patient about the consistent use of protective equipment for the head and face during sports. Check the ears, first one and then the other. Examine the nose. Is there evidence of prior injury? Is the nasal septum deviated? Is the patient able to inhale and exhale easily through both nares? Are the teeth in good repair? Are there any caps, partial plates, or other devices that may require a special protective mouthpiece? Are there rampant caries that could result in easily broken teeth in the event of a blow to the mouth? When was the last dental visit? Thoroughly examine the lymph nodes to rule out any undiagnosed infection. As well as the nodes of the head and neck, don't forget to check the infra and supraclavicular nodes. Having the patient shrug her shoulders makes examining this area easier. Also palpate the axillary nodes. Support the patient's arm and feel high in the axilla, using a motion as if washing the inside of a cup or glass. The lungs should be assessed thoroughly. Auscultate in all areas on both the chest and back of the patient. Asthma is a common condition among children. It is no longer a contraindication to participating in most sports for most students. The use of multi-dose inhalers and an adequate warm-up period before playing can help decrease attacks. If appropriate, make sure that the patient is able to carry her inhaler with her at school. If not, Provide the appropriate documentation for the child to give to the school nurse to make this possible. The cardiovascular evaluation is one of the most important parts of the pre-participation physical, since some sports place enormous demands on the heart. Auscultate the heart in all 4 valvular areas using the bell and the diaphragm with the patient sitting. Most asymptomatic grade 1 or 2 systolic murmurs do not need further evaluation. However, any other abnormal sounds, a history of syncope, palpitations, chest pain, or a family history of sudden death need to be further evaluated. The peripheral pulses should be assessed and charted. Check the radial, the posterior tibial, and the dorsalis pedis bilaterally. Now have the patient lie supine. Auscultate the heart again in all 4 valvular areas, using both the diaphragm and the bell. During the cardiac examination is a good time to ask about the use of cocaine and anabolic steroids, since both have been implicated in cardiac problems in athletes. Examine the abdomen. Pay particular attention to the liver and spleen. Have the patient turn slightly on her right side to make palpation of the spleen easier. If enlargement of either organ is present, consultation or referral is indicated. Palpate the inguinal nodes. The genital exam is deferred in females unless indicated. For the male, review the male genital portion of your examination videotape. A very important component of the pre-participation physical is the orthopedic screening exam. This examination is designed to assess decreased range of motion and strength, instability of the ligaments, pain or swelling in the joints, and loss of functional ability. Many injuries are re-injuries, so pay particular attention to any area of prior trauma. Ideally, the sports physical should be performed at least a month prior to the start of practice to allow for referral or conditioning as needed. Start with the patient standing facing you with her arms at her sides. Observe for any asymmetry of the upper and lower extremities and trunk. Are the shoulders and hips even? Is there a difference in leg length? Have the patient perform range of motion of the neck. Is she able to touch her chin to her chest and her ears to her shoulders? Is she able to look over both shoulders equally? Loss of flexion, rotation, or lateral bending usually indicate a prior neck injury. Ask the patient to shrug her shoulders while you try to hold them down. Are the trapezius muscles of equal strength? Now have the teen hold her arms out to the sides and try to lift them while you push down. Again, is the strength equal? If not, observe for any wasting of the deltoid muscles on the weaker side. Next, ask the patient to hold her arms out to the sides and flex the elbows at a 90-degree angle as shown. If this movement is asymmetrical, ask about the possibility of a prior dislocation of the shoulder on the affected side. Now have her hold her arms straight out to the sides with the palms up and bend the elbows so that her palms touch her shoulders. The movement should be the same on the right and the left. Ask the patient to hold her hands out in front of her with her arms at her sides. Have her pronate and supinate her palms. Movement should be easy and symmetrical. Have her make a fist and spread her fingers. The fist should be tight bilaterally and extension of the fingers complete. Now examine the patient's back. Have her stand straight with her arms at her sides. Are this patient's shoulders, scapula, waist, and hips symmetrical? Next, have her put her hands above her head and bend forward slowly. Is the back symmetrical? Note that the right side of this girl's back appears higher than the left. This is due to scoliosis, a lateral and rotary curvature of the spine. This condition often becomes evident during adolescence and is more common in girls than in boys. A patient with scoliosis should be referred for evaluation. Have the patient walk on her heels and toes. There should be equal elevation on both sides, and the calf muscles should be symmetrical. Finally, have the patient squat and walk several steps toward you, and then return to a standing position. This is called the duck walk. This maneuver should be smooth and painless. Both knees should be able to bend equally. Make sure that the patient stands up without twisting or bending to one side. This concludes the examination portion of the pre-participation physical. However, patient education is also a very important part of the visit. The adolescent years are a time of tremendous preventable morbidity and mortality, and teens are often unable to consistently understand the impact of their present behavior on their future, and therefore indulge in many types of risky behavior. The major causes of death in this age group are unintentional injuries, homicide, and suicide. In fact, a staggering 25% of high school students have seriously considered suicide, and at least 8% have attempted to end their lives. Major morbidity is most often due to depression, substance abuse, sexually transmitted infections, and pregnancy. Therefore, an important goal of patient education for this age group is the reduction of high-risk behaviors and the prevention of injury. Some appropriate topics for discussion might include sexuality and its inherent risks, seatbelt use and the importance of never riding with a driver who has been drinking, the use of protective sports gear, and the avoidance of smoking, alcohol, drugs, chewing tobacco, etc. Also address any other issues introduced by the patient or parents. Finally, make sure that all immunizations are up to date, paying special attention to those for hepatitis B and tetanus.